I'll start with my career in medicine changed before I even graduated. In fourth year clinical work, I challenged one of the professors about the management of an elderly lady with cancer, and I asked him about her nutritional status, and he retorted that we are treating the cancer in the bed. Her diet has got nothing to do with what we're doing. In looking after animals, breeding animals and productive animals, including very expensive animals, breeding stock. And we would never treat an ill animal as we treated that lady in the bed. So I decided I was going to be a different doctor. Said that to myself. I said it to my friends in the year that we were in, fourth year medicine. And that's set me on a different journey. I think the medical school probably regrets ever having me as a student because of my different attitude to people's health. So from then on, I decided to look at all of the aspects of healthcare and medicine around the world. I travelled extensively and came back, set up a clinic, and helped to set up the College of Nutritional and Environmental Medicine. I was the founding president for 26 years, and trained a lot of doctors and other healthcare professionals in nutritional therapeutics and the associated specialties like nutritional cardiology, nutritional immunology, nutritional neurology, etc. Very, very exciting and challenging career. I feel very fortunate to have been able to think laterally and outside the square. And I watched young people go into medicine being completely brainwashed for 6 years, after 6 years primary school and 6 years secondary school, and another 6 years in medicine and another 4 years specialising. At the end of it, you've got a doctor who's had no real experience in life at all. And I'm not critical of my colleagues. I'm critical about the way they've been trained and about the way they think. We do some wonderful things in Western medicine. We've got fantastic approaches to surgery and anaesthetics and recovery and acute interventive procedures that save lives. But when it comes to the rest of medicine, it's a complete and utter flop, and it's very dangerous. So that's it in a summary. I started giving high-dose intravenous vitamin C at the request of a patient who'd come in from the US, and I did with trepidation because it was experimental. But I, of course, had full informed consent from the patient, as much as I could inform the patient about high-dose intravenous vitamin C. And then that developed into a clinic where I was actually giving high-dose intravenous vitamin C, both in the clinic and in hospitals, for a whole range of acute and chronic degenerative conditions, including cancer, HIV, AIDS, and so on. We were getting success with HIV, AIDS, saving people's lives, extending their lives, treating opportunistic infections very effectively with nutrients and IV vitamin C. I wrote a book, and that was a book called The AIDS Fighters. The late very honourable Dr. Linus Pauling wrote the foreword for it, and we ended up, I was challenged by the Medical Board of Victoria. They accused me of infamous conduct in a professional respect for doing such treatment. And fortunately, I was able to employ the services of 3 very powerful lawyers, and my appeal to the Supreme Court against the Victorian Medical Board's findings of infamous conduct was thrown out of court. The board was chastised and reprimanded by the justice in the Supreme Court. And from then on, I was almost immune from any attacks from the authorities for probably the next 30 years. And that gave me an opportunity to help other doctors in trouble as well, because what we were doing, it was more in the public interest. And back in those days, the public interest was very, very important, and including from the mainstream media. It's turned around 180 degrees now, of course, as we all know.
Ian, I just want you mentioned IV vitamin C very quickly. A lot of people here know that, but for the purposes of the recording, you have had remarkable results over the last 40 years with intravenous vitamin C for people on death's door. And, can you just reinforce that? And then we'll go to Glenn, just to, for people to understand. And secondly, the evil that stops that hospitals refuse to give intravenous vitamin C to patients. Can you just touch on that? And then we'll go to Glenn.
Sure. Thanks, Charles. Just a word of advice for everybody. If you're getting sick, no matter what, increase your intake of vitamin C. It can be 1 gram, 4 grams, 10 grams a day. We talk about a 10-gram cold, a 20-gram flu, a 30-gram serious flu, 100-gram cancer, etc., etc. So vitamin C is absolutely essential for humanity. We are part of the higher apes, if you like, and the higher apes cannot manufacture vitamin C in their own system. So when we are under stress, chemical, physical, surgical, electrical, viral, bacterial, biological stress, we need extra ascorbate to stop the production of radicals and also to fight the bacteria and viruses, because ascorbate produces, or vitamin C produces hydrogen peroxide, which works in our white blood cells to kill the viruses and bacteria. Charles talks about life-saving. Well, yeah, people at the end of life, we can actually improve their well-being in certain circumstances, but I'll ask you to have a look at one of my Substacks, or go onto YouTube, Google dairy farmer, New Zealand dairy farmer, vitamin C, living proof. This was a dairy farmer who had swine flu and was on ECMO, extracorporeal membrane oxygenation, which is basically life support, for 6 weeks in Auckland Hospital. And the experts around the world said that this guy was not going to survive. He was in an induced coma. He had lung whiteout, which means he had lung failure. His kidneys had shut down, renal failure. And he also had hairy cell leukemia. The relatives pleaded with the hospital and took legal action to get the hospital to give this patient high-dose intravenous vitamin C. There are 2 60-minute stories on YouTube about this gentleman, and one of them is on my Substack, Ian Brighthope Substack. He was given the intravenous vitamin C against the hospital's wishes, and after 4 days, his lungs started showing black spots, which means aeration of the lung. So he started aerating his lungs. He eventually came off ECMO because his lungs recovered, his kidneys recovered, and interestingly, this was in 2008, 2009. He's still alive today. This man was told by the world's experts, who the hospital in Auckland consulted, about his prognosis. And everybody said he's going to die. Well, there was a kerfuffle, a real story after that. But this gentleman was really almost beyond. He was on the deathbed, and he was very much beyond help. And I didn't think he was going to survive. But very important issue is here, they stopped the vitamin C and he started zero. So never, ever stop the vitamin C. If you situation like that, or if cancer, or you've got an autoimmune disease, or you've got a country, slow down to a maintenance level from the high levels that you've been on. Another 60-minute show, we got a young lady who was also on ECMO. She was 21, I think, in one of Sydney, Australia's hospitals. She had swine flu as well. We got her off the ECMO, off the life support with the vitamin C, but the doctors refused to continue it. So she died. So she was on a deathbed. We got her off the deathbed. She was breathing. It looked like she was going to be healthy again, and they stopped the vitamin C. So there's some very salient lessons there. Never to stop it, never abruptly stop a life-saving nutrient. And I think that there's so many stories around this, but they are a couple of stories.
That's a great story. Someone's posted the link. Thank you, Karen. And you just call it a nutrient, and the last thing I would like you just to articulate that you've taught me that vitamin C is a redox reagent. It's not just a nutrient. So could you just touch on that, so that, because people go, vitamin C, how could vitamins do what you are talking about?
Right. Well, vitamins, vita means life, and amine means amine, and these things were discovered in the bran of rice and yeast a long, long time ago. And we discovered that without these very small quantities of these substances, we got sick and died. For the lack of vitamin B3, for example, we end up with pellagra, and pellagra is the 4Ds. It's dermatitis, diarrhea, dementia, and death. And it's vitamin B3, fixes it. But if you're going to have optimal good health after a vitamin B3 deficiency, you're going to need higher doses of the B3 to work. It's just simply a biological fact. With vitamin C, well, we have evolved out of the jungles where we had access to high levels of these redox reagents or antioxidants and pro-oxidants, and we end up with a fairly crappy sort of diet now, and living in a dirty environment. Excuse the expressions, but this is the way I see it. Most just full of poisons and processed poisons and extracted foods. And we end up with empty calories and empty fats and empty proteins without all of the critical nutrients that are important in a holistic diet, a diet that contains all of your trace elements, all of your vitamins, all of your amino acids, and so on. So for over a long period of time, if we're low in these things and we're high in sugar and salt and fat, for example, we end up with a related disease. 20 pounds of sugar per head per year. It used to be the average during the Second World War. Well, the intake of sugar has increased to over 120, 150 pounds of sugar per head per annum. And no wonder we've got obesity and heart disease and diabetes and the other problems that we see with the overconsumption of refined carbohydrates, empty calories, for example. So we sometimes, over a long period of time, increase our need for some of these trace elements and vitamins in particular for optimal good health. The other thing is, as we get older, we don't absorb things over the age of 30, 35. We start losing the ability to produce hydrochloric acid in the stomach, so our digestive systems are not as good as when we were younger, so we don't absorb things well. And if we're in a high grain diet or a high bean diet, we end up with deficiencies of things like iron and zinc, which are bound up to these grains and not absorbed into the system. There's a whole, we take a lot of antibiotics. They're already present in a lot of our foods. This upsets our microbiome, more bugs in the gut, and that has a serious effect on our health. And most of us are walking around with unhealthy microbiomes. And just consider this, the microbiome is an organ, and until it's excreted, it's got a major function in the body.
That's very good. That's a wonderful overview, and I love that, of vitamins, vita plus amines. So, because there are plenty of non-doctors here as well, as you know. So thank you for that. Let's get to the questions, Glenn.